how do advanced abstracts created by AAER AI improve engagement and interaction in mental health research?
So let's say, for example, I share with you one of my publication has around 9,381 people's data has been readmitted in the hospital more than 3 times. And then this person who's being a care provider needs to adjust the therapeutic ways for a patient to get better, not to go and readmit in the hospital. That is where inclusiveness kicks in of the system with the ranges which are being aligned by the AI agents for a care provider to follow, and not to follow verbatim, but to make changes accordingly. Hope this helps.
Welcome to Bots and Bytes, the ultimate tech talk podcast. Join us as we journey from the realm of AI to the boundless expanse of the cloud. We'll explore the cutting-edge technologies that are reshaping customer experiences and driving businesses to new heights. Prepare to be inspired, informed, and intrigued as we delve into the world of innovation and transformation. I'm your host, Jess Vigorito, and this is Bots and Bytes, a GTS production where tech dreams become reality. Let's dive in.
What are some of the challenges? We talk a lot about all the benefits so far. What are some of the challenges of using this type of AI for mental health care?
So the challenges are the systems like the healthcare systems have different guidelines, and the policies and procedures set are changing, but on a very slow pace. Like the telehealth, I started my involvement in telehealth in 2013 for 3 hospital systems in Midwest, where they were trying to instantiate servicing from a call center by employing the nurses with licenses in 3 or 4 states at one time. However, the patients were not very much willing to opt for that. They wanted to see an individual because, and again, Midwestern states are farmland. You don't see another farmer for several hundred acres. There are times you're usually alone, you're running around with your family and all that. It's a possibility your family has grown up, they're gone, and then you're just with your wife or husband or somebody who's helping you out. And that demographic is different. But that was 2013. This is 2023. It is more the pre-pandemic world was different. The post-pandemic world is different because now we can see even the people who were hesitant of the technology are coming and talking, and it's more of an employment of artificially intelligent smart agents to work with all these areas. So you might have noticed that now you're getting in the text from your pharmacy that your medication is ready, come and pick it up. And however, pre-pandemic, that would have been like, why the pharmacy is texting me. Now the delivery can happen on the curbside. That's a change. So the change is slow, but definitely coming in. And with the involvement of all these technologies, the pace is slow because opting for a technology is not inherent in human beings. Education plays a part. Like what you are doing at this moment is sharing your personal stories, which are so powerful. And I shared with you the idea of my son going to the university and how the bigger context kicks in. The professor will never come to me, but I can obviously reach the professor that what is happening. I'm not asking you to tell me the grade, but what is happening with my son? Why he is losing the interest in your class? That's a straight question because I'm a professor myself. So to professor, that's a little relevant discussion. But in your case, the middle school, you have to deal with several of those teachers. However, if a class where your daughter sits has a sensory input that is coming to you, that it had been, a situation where she would have been given a chance to work at her desk, rather she has been brought up on the podium. Again, camera is not needed for that. It's the movement of your daughter. And let me give you an example. I was traveling to Europe a couple of weeks ago. I came to know that some of the passengers' luggage was not there, but one passenger told right in front of us, "Here's my luggage in Copenhagen." And you said that it's already been at Amsterdam. And the other side of the airline side, they had no idea what this person was speaking. She had an app where she showed, "This is my luggage, this is a tag, and this is not even left Copenhagen. And you're saying this has been delivered and I should pick this up. It should be on that side. And I'm traveling to God knows where, XYZ, Bahamas, for example. Now, me being a traveler, this is going to be a big hassle for me to go to Bahamas, where I have everything left in Copenhagen, where I came through Amsterdam and I'm flying a bigger flight. So the technology involvement is lesser on some sides where the policies need to be, more inclusive of bringing in technology aspects. And that's like mental health kicks in right away, right? I am now in anxiety that my luggage is not here, but I am flying in 2 hours. I have to pick this up and take to the other flight. That's a very small anxiety level, but anxiety is anxiety.
We've covered this a little bit, but how does it contribute to building trust between patients and chatbots for meaningful therapeutic conversations? So we've discussed like patients and providers, but I mean, I've shared a story before about like a recent interaction that I had with a chatbot, which was far superior to any exchange that I've had to do with a human. I was returning a product and it was fantastic. And so just from that transaction, I already have more trust for this particular chatbot. How does this type of AI contribute to building that trust between patients and chatbots?
Here, I would suggest you to change terminology. This is no longer a chatbot.
Okay.
This is a smart agent. It's technically smart AI agent, artificially intelligent agent. A chatbot is just intent and event, intent and event, intent and event. Smart AI agent is intent, event, and the consequences. And the consequences are either you're happy, you can be happy with the service of an agent, or you can be unhappy. There's no middle ground.
Yes.
There's no neutral. Okay, it's not helping me. That's not happening. As a human, we are content when we are not dealing with somebody. We are neither happy nor sad. We are content, right in the middle ground. As a human, we do that. But smart AI agent, when looks at your questions that I have to return this thing, or I am feeling sadness. As a human, you understand, you will look at my face or you will look at my tone that what I'm speaking, I'm feeling sad. And it has like a down tone. As a human, you can. A smart AI agent can look at the, frequency of your talk. You're excited, you're happy, you want to do something, or you're just sad. And again, as a human, we understand that smart AI agent creates those ranges of discussion. This person is speaking on a monotonous way. The person is happy and showing happiness because when you smile, it comes out of your discussion. But when you're sad, the sadness comes out of your discussion. And all the negative connotations was my uncle passed away. It was such a sad incident. I couldn't speak with him. That's a sentence. For smart AI, a chatbot would never understand this thing. Smart AI agent has looked at passed away. What does passed away means? Okay, that means somebody died. Somebody died, and this person is speaking when somebody died. So, what is the consequences that this person might go and lapse as a mental health, or I should give that person an individual to speak with, or just share? I'm really sorry to hear your uncle passing. That's a phenomena where it is fine for you to be sad or not an upbeat. The best way to remember that individual, please share what that individual meant to you. Now that's an intelligent intent that had been asked by the smart AI agent to the person whose uncle passed away. But a chatbot will never do that. You might say that we can add the intent, but then it's us who's asking chatbot to do this. Smart AI agent would generate a context and then execute it. That's a difference.
That's a huge difference.
And that was not there. That was not in the previous versions of Google or Alexa or the Siri. However, when you say to Siri now, let me tell you this. So, Siri, I don't like you. So I'm just trying to do my job. Is there anything else I can help you with? Just let me know. So because I had my mic switched off, so it didn't repeat, but I read you what it said. So it is even intelligent or aware that if I am not happy with Siri, what to answer. So the incorporation since the time of Eliza, Eliza, the first chatbot, earlier chatbots, we are way beyond incorporating the generative AI, which can generate sentences. Sentences are usually coherent as a human, but they are coming out from BART, from BOM, from Bedrock, from ChatGPT, that it can write a story with emotions associated. So, smart AI agent, your experience is very good. My experience is not that bad, even. There are times when I'm speaking with this AI agent and it's giving me the answers which a human would give, and I would rather not waste my time with a human at that aspect. So, yes, that is happening on a very slow pace. Again, inclusiveness means including technology as well.
I like that spin. That's definitely something that I think most of us don't consider, is that inclusiveness does require us embracing the technology that helps us be more inclusive to other humans.
I would suggest everyone who's listening to that or watching this to read Dan Brown's novel, the latest one. I don't remember the name, but it has technology called Technium. Dan Brown's latest novel,
Origin?
Origin.
I haven't read any of his books in a few years. So
Well,
I have not read Origin, but I am a fan of his. So
the reason why I said that, when I read it a while back. That's why I'm not remembering the name. But it is so close to our reality at this very moment. 1984 Orwell was relevant for us, but irrelevant for the time when it was written. So the relevance of Dan Brown's Origin is very, very near to us at this moment. In terms of the inclusiveness that I just discussed with you, that do not just exclude things, and do not be a person who avoids the technology. Well, you can live as a nomad, yes, but then that's your choice. However, to be inclusive within a society, if I start living in Grand Forks, North Dakota, wherever I am, and I stop using all technology, then who's at loss? Me.
yeah, ultimately you are.
Yeah, it does not impact the other people surrounding me or living in this area.
Absolutely. What are some potential ways that this can be used to address the mental health crisis in the US and maybe even globally?
The idea is the incorporation of mental health education along with the artificially intelligent, agents working with those care providers who are going to be care providers, and role playing as a patient is the next level, which is my strong understanding. Because when a student is taking all these care provision classes in nursing or in psychiatrist, going to be a psychiatrist, psychologist, reads research and all that jazz. However, at Global Technology Solutions, we certainly can help these all educational institutions to have these AI agents who can behave like a patient. And if an individual can be, given some correctedness in terms of a path for the betterment, these AI agents can actually go at the same way. And either they're happy or they're sad or they're content. If they are content, it means that they are near happiness. If they are less content, then they are near sadness. Now, I just shared with you three contexts. That's as an individual, you and me feel in our day, right? It's a possibility my tone is low, but it's also a possibility as a connected that I'm tired and I need to sleep. And I'm just trying to avoid any discussions. As a human, will AI agent ever do that? No. But we can teach by writing large language models to this smart AI agent to behave like that. Some yawning coming out of that. Just forget it. It's over. My computer needs to just lay down and rest. That does not happen in the regular life for the smart AI agent. But we can certainly work with these nursing colleges or psychology departments to create these sort of artificial patients who then been tested by the original individual who's going to be serving in some serving capacity. That can be the next domain, actually.
It is exciting to see. You just explained the difference between chatbots and smart agents, and chatbots, that technology isn't even old. Like, we're still using chatbots, but yet there's already this next level intuitive, almost smart agent. And I know it's not actually intuitive, but it's collecting data that makes it seem almost intuitive. It's very exciting to imagine what the next level is also.
That is absolutely correct. It's generating. And if the generated answer has a positive connotation and has been accepted by a human, then it has been added to a knowledge base where this is good. And if the generated response is not liked by the individual, then it is going in a different bucket. Oh, I try not to use this thing again.
Right. And is that why when Chat GPT, when I ask it to regenerate a response and then it asks me a question, is this one better? And then I give it the thumbs up, so I'm literally teaching it in that moment.
And that thumbs up or thumbs down is technically the two databases. Where thumbs up, yeah, it's all good. Let's use this in the future. It's down. Let me try to avoid this thing if this sort of question comes to me in a different way.
So this has really been enlightening for me, and I think for our audience too, in showing how AI can truly revolutionize care across the board, but especially for mental health. I really appreciate that we've looked at it from the patient's point of view. How does this also support mental health professionals, and not just in policy? I know we touched on that already, but how does it help them in their day-to-day jobs?
So they can actually strategize with the smart agent that I'm going to deal with these areas in mental health today. And that's a possibility. It's Wednesday, and then I'm just serving all those people who have PTSD, for example, and I'm a care provider. So I go and sit down with my smart agent 30 minutes before I just start working with the patients. And I say, okay, hey, Gen AI agent, I'm going to deal with PTSD folks, and I would like you to look at my previous notes of my previous PTSD patients discussions and look at my current patients who I'm going to speak with and create a as comprehensive as you can steps to me to do questions and answering or create a set of questions that's a possibility that patients might be asking me. And then when the patient asks a question, that question matches with that question, even 80%, then it means that my job as a provider is easier because that questions which were created by Gen AI is also edited by Gen AI, which I read. I might agree with that. I might not agree with that. I might partially agree with that as a provider. So that is something that does not exist. But people can come to us in Global Technology Solutions. We can definitely work with the providers on this aspect. And it is no longer a chatbot because I am now working with a smart agent who's dealing with me one on one, where the patient is not even involved at this moment, unless he or she or they come and speak with us. Us means and Gen AI agent.
What do you see is the potential of AAER AI, And the next generation, I'm not going to say chatbots, the next generation smart agents transforming mental health care in the future.
It's pretty much like Ameka or Sophia Hansen, those robots. Even though we know that they are robots, but we can converse with them. As a human, we have a little satisfaction when we are looking at a humanoid sort of robot. And I understand not everybody is me, but not everybody is you too. You're open to the technology. And so is many people who are receptive to the technology. Obviously, we cannot speak with my this thing. But it's a possibility if I pick it up and it has, some sort of audio associated. You have your glasses on your nose. And so
Oh, right.
so I just pick it up before I even go like this. Now the sensors are saying, oh, this is going to open. So this is going to be happening. I pick the book up and the book has sensor. Oh, you were on page number 109, line number this. That's where we are heading, actually. That's where we are heading. Like the auto driven cars.
Right.
You are a mental health patient and you're aware that you have mental health issue. But you sit in the car and you tell, do not open, do not give me the control, but take me to the hospital.
So this makes me think of Baymax from Big Hero 6.
Yeah.
Because Baymax, anytime someone says ouch, Baymax is suddenly activated.
Yeah.
You're hurt. How can I help you? And they do the scans, and Baymax is there as a servant to humans to assist and to help when a physician is not available, or to work in partnership with a physician.
Like the old homes. The biggest problem that we saw in pandemic, the old homes has less staff.
Yes.
These trolleys could be the intelligent agents. The food is being, prepped. Now you might have seen those in AI enabled robots cooking in the food and all that jazz. And there are a couple of McDonald's where there's no human, except the person who's stacking the burgers and all that, and that been as served. So the biggest thing we can start in an old home where we can create these trolleys aware that this individual has done his or her their breakfast and now just they need to put, and the trolley comes in automatically and a voice activated. So you're done with your breakfast. Can you please put your pots on so I can take it for the washing? That's the easiest incorporation that can happen.
But so significant. Like it's so easy, it's so simple, but it's so significant at the same time.
Correct.
It has a big impact.
Yeah, that is absolutely correct.
As we're wrapping up now, what are some key takeaways that you want to share with me, with everyone, from your research regarding the role of AAER AI in mental health care and its impact on patients and professionals?
First of all, thank you so much for the opportunity. And I would sincerely share these things because I had been involved with mental health. My career at OnTrack was 100% mental health servicing domain. I have noticed what I have studied and all that. Mental health is every individual mental health patient is different. It's highly unlikely that you might find two individuals with the same issue that they're facing in terms of mental health. The healthcare provider, a nurse coach, a care coach, a psychiatrist, psychologist, they must be aware of the comorbid conditions that an individual is coming up with rather jumping into blindly with a blindfold on to start serving someone. And generative AI can help the PCPs, the primary care physicians, the nurses, practicing nurses, the serving nurses, the administrative staff, the pharmacy, to combine all these information before a psychiatrist or psychologist hits that individual to make him, her, or them follow a better path towards their better health. Should not do blindly. And generative AI can actually encompass all these things for the care provider to be aware before making a call, before speaking with an individual.
Where should people go if they want to learn more about implementing this type of tech?
Well, they can always visit Global Technology Solutions website. They are welcome to look at the research I have conducted, extensively published in the use of artificial intelligence in the loneliness epidemic, in the congestive heart failure readmission prevention, type 2 diabetes, how to manage that, and also in the arena of mental health to make AI agents at a level where they are context aware. So you can reach us. You can find us on Global Technology Solutions website. You can reach us at LinkedIn. We'll be glad to help you out whether you are a patient who's of context aware of your situation and you want to go to the next level. You can be a care provider, you can be a hospital system, you can be a clinical system. We can help you sit down, create those strategies, policies, and procedures that you can incorporate for an inclusive resolution for someone to get better.
That's how, like, Globotech is Globo, GLOBO dash tech, TEK.com. That's the website that Dr. Atif is referring to for Global Technology Solutions. What's the best way for people to find you specifically?
LinkedIn, Atif Mohammad, PhD.
There you have it, folks. Thanks for tuning in to this mind-blowing episode of Bots and Bytes. Special thanks to our guest, Dr. Atif, for sharing invaluable insights and education about the state of mental health and AI in our country and globally, and all the exciting tech and advances that are happening right now. To all of our listeners, we appreciate you joining us on this captivating tech journey. Stay informed and inspired by subscribing to our podcast for future exciting discussions and expert guests. Thank you so much for being here today, Dr. Atif.
Thank you, Jess. Thank you for giving me the opportunity. Take good care of yourself.
Thank you. This is Jess V signing off. Stay curious, stay tech savvy, and keep exploring limitless innovation possibilities.